This month, we want to bring attention to oral cancer. It accounts for roughly 3% of all cancers diagnosed yearly in the U.S. Dr. Mitch Dang is here to tell us more about how this impacts people of all ages. Thank you so much for joining us. Good Friday morning.
Thank you for having me.
Absolutely. Okay, let's start this conversation by defining what oral cancer is. What is it?
Well, oral cancer is just basically any cell in the body that from normal changing into something that's abnormal.
Yeah.
And it also classifies from stage 0, which is called carcinoma in situ, through 1, 2, 3, and 4. And to be honest, a lot of people don't talk about oral cancer.
Yeah.
It's one of the least talk about of everything, that from lung cancer to ovarian cancer, breast cancer. It actually, about 54,000 people will be affected per year in the U.S. and 71% of those people will have a very high mortality rate because of the late diagnosis.
Late diagnosis.
Yes, sir.
And the hope is, from conversations like this, people will be more aware and get screened and detected. With that said, we'll get to screening in just a moment. Do we know what causes it?
Well, traditionally speaking, tobacco user and alcohol user make up majority of the cases.
Yeah.
About 75%.
Wow.
The other 25% could be from genetics, but 18 years past data shown that is actually on the rise due to HPV and recently also due to vaping.
Oh, wow. Yeah. Yeah. Some signs and symptoms.
Well, typically you don't notice anything, maybe a small ulcer on the side of the tongue, maybe the roof of the palate, but a lot of people would just pass it off as maybe I ate something that injured.
Bit my cheek,
exactly.
bit my tongue.
Absolutely.
Yeah, a cold sore. So mistaken for something else.
Exactly, but one of the key to look for is, of course, an ulcer that does not heal within 2 to 3 weeks, because as with most injury, things tend to heal up in about 2 weeks.
Yeah. Let's talk about screening. Where does one go to get screened? Is this something that happens at the dentist?
Yes, absolutely. Actually, at our practice, we are working with Forward Science, which makes this wonderful light. It's called the Oral ID. And it's very simple, non-invasive. It's not like a colonoscopy where you have to run an endoscope into the mouth or anything like that, but it's just a simple flashlight. And with a certain wavelength, it's actually a blue light that normal tissue will absorb off that, but abnormal tissue
will be highlighted.
Not.
Yeah,
exactly. So if we have a special filter, the glasses that we wear, we can see that everything will glow green. But in cancer or precancerous tissues, the whole area is turned dark.
How often should one get screened?
Every year, annually.
Every year. Once a year.
Yes, sir.
Yeah, my dentist offers this, and this is something that I do. I go every 3 months. I pay the extra to go.
I highly recommend it.
Yeah, I like a clean mouth. But it's important, you know. A lot of our health starts here in our mouth.
You're absolutely right.
Yeah, and so it's important to be on top of these things. For people interested in learning more about this, or if they're not aware if their dentist offers this type of screening, it starts by having a conversation with that person.
Always.
Yeah.
Always. Yes. You can always visit our website, beechnutdentalcare.com. We have a whole page dedicated to oral cancer and the screening.
Okay. All good information. Dr. Dang, thank you so much for coming in this morning.